So I'm working on a 14-year-old boy. Can you see it, Mom, through the camera pretty good? He has a pretty gnarly scoliosis, and so he has tight muscles here pulling the spine this way. He has tight muscles here and a rotation pulling it all up and over. So I'm gonna teach his parents how to loosen the tissue with the FasciaBlaster to basically, so some of this can start to let go and the spine can begin over time to retrain to be straight, okay? So the technique is, it's actually really, really easy. So I'm just looping him up real good. Now, when you look at it, what does your intuition tell you? Anywhere we have a hump, okay, that's gonna be where we wanna start, okay? So the spine is here, so it's better to get at this angle and just start kind of going off on it like this. I'm not gonna do a real time, we'll do a before and after, but so we're gonna get after this hump this way. You can also do it with 2 hands. I don't know if you've noticed in a lot of my videos, I just jump on top of the client, whatever it takes, you know, so it's your kid, so you could jump on top of him if you want and use 2 hands, or you can go after it this way. And then we'll go straight up and down. And what I like to do is use like the last 2 claws to do that part, okay? Now, this next hump is a little trickier because we have ribs. So we're gonna come inside the scapula, which the scapula is sitting right here like this, and take the whole thing, and we're gonna come across. And don't let it scare you, because it's kind of, can you hear that? It's like making a little noise, like, that's okay. You are going across the ribs, but there is meat and tissue, and he said it feels good. Okay, so I'm just coming on the inside of the scapula. The only thing I would say is just watch out when you have someone face down. I actually knocked someone in the head when they turned up to say something to me, so make sure to tell your kid or whoever you're working on to keep your head in the hole. And we're gonna come across like this, okay? And then once I start to get that loose, I'm gonna do the old school technique where you go all the way up the sides of the spine like this, and then all the way up the sides of the spine like this, and then we'll loosen both scapulas here, which that line feels really good, and then we'll do the scapulas here, okay? And all this is gonna do is really open the fascia up so that you can get down to the deeper layers, and then you can actually use an elbow, or if you're doing it to yourself, that's where you would place a softball and lay on it. With this kind of extreme rotation, a foam roller would be reasonably helpful. But the key is breaking up the fascia first.